Good morning. I am Dr. Monica Rathor, Professor and Head, Department of Pediatric and Preventive Dentistry, BBDCODS, BBD University. Today I will be discussing about self-correcting anomalies. So what are self-correcting anomalies? Self-correcting anomalies are the anomalies which arise in child's developing dentition during the period of transition from gum pad stage to permanent dentition. As we know, from birth till adulthood, dental occlusion goes through a significant changes and there will be periods of malocclusion. These are called self-correcting malocclusion or transient malocclusion because at one point of time they look like malocclusion, but these conditions correct on its own with normal growth without any dental treatment. Self-correcting anomalies are present in all periods of development, that is, predentate period, primary dentition, in mixed dentition, and in permanent dentition. Predentate period. In predentate period, neonate does not have any teeth. 6 months after the birth is known as predentate period, and the alveolar processes at birth are called gum pads. The various self-correcting anomalies in predentate period are retrognathic mandible, anterior open bite, infantile swallow. Retrognathic mandible. This is a condition in which the mandible is placed posteriorly to the maxilla, and this is corrected with differential and forward growth of the mandible, and mandible grows at a faster rate than that of maxilla, and this condition is corrected. Anterior open bite. In the gum pad, as there are no teeth present, so with the eruption of anterior teeth, anterior open bite is corrected. Infantile swallow. In infantile swallow, the tongue is placed between upper and lower gum pads and jaws are separated. This helps in child in suckling. And this condition is corrected during first year of life with introduction of semi-solid food, solid food, and eruption of the teeth. And then gradually the infantile swallow is converted into mature swallow. The various self-correcting anomalies present in primary dentition are anterior open bite, primary spacing, flush terminal plane. Anterior deep bite. Anterior deep bite is corrected with eruption of primary molars, attrition of incisal edges, forward and downward growth of mandible. Primary spacing, these are of two types, physiological spacing and primate spacing. Physiological spaces are generalized spaces which are present between all the teeth. And the primate spaces are present mesial to maxillary primary canine and distal to mandibular canine. And these spaces are utilized for eruption of permanent teeth as they are larger in size. So this condition is corrected on its own with the eruption of permanent teeth. Flush terminal plane. In presence of flush terminal plane in primary dentition indicates normal occlusion relationship in permanent dentition, and this condition is corrected with early shift, early mesial shift and late mesial shift. The various self-correcting anomalies in mixed dentition are mandibular anterior crowding, ugly duckling stage, and non-relation of first permanent molar. As we know, the permanent incisors are larger than their primary counterparts, and the permanent incisors also erupt lingually to the primary incisor, resulting in transient crowding. And this condition is corrected by secondary spacing, increase in the intercanine width, and by tongue pressure. What is ugly duckling stage? This is also known as Broadbent phenomena, as the permanent maxillary canines erupt, they displace the root of maxillary lateral incisor, and central incisor mesially and causes distal divergence of the crown leading to midline diastema. And this condition is corrected with the eruption of maxillary permanent canines. The end-on relationship of first permanent molar is corrected by utilizing the leeway space by late mesial shift. So, learning about the development of dentition is important because then only we can know about deviation from normal and can start early intervention if required and refrain ourselves from any dental treatment if it is a self-correcting anomaly. Thank you.